So Dr. Teckman continuously strives to improve the quality of life for his patients, particularly those with inflammatory bowel disease, because he thinks about the whole person, how this kid is part of the soccer team and as a member of their family, and how the treatment strategies that we implement, like how is that going to affect their lives?
He's very responsive to their needs. He gets involved with their lives. His care is totally personal to them. Sometimes I have trouble remembering which kid is this, and then he can give me like the whole backstory because he sat down, at diagnosis and found out what made them tick.
So Dr. Teckman has a very unique and special ability to make very complicated disease pathology into ways that patients and families can understand and digest. And not only that, taking it a step further to provide them a roadmap of what's tomorrow going to bring? What's a few weeks from now? What's a year from now?
He's kind of tireless when he gets a project, and every newly diagnosed IBD kid is like a project for him. And he hits them with what he sees as the best medicines, and is usually having us check on them a lot to make sure that the medicines are working. If they're not, then we're revising that plan, trying to get them in remission as quickly as we can. The latest studies show that the quicker you get them in remission, the more sustained that is, and he takes that to heart.
Having a Catalyst Award is incredibly pleasurable for me, and I feel very humble, but also very accomplished, because I think in my role the last few years at St. Louis U and Cardinal Glennon, that's exactly what I've wanted to be. I've loved taking care of sick kids and kids with Crohn's and colitis on my own, but by forming a team and empowering that team, whether it's physicians or nurses or other staff, to help make kids well, and bringing together resources from radiology and from the lab and from fundraising to make life better for kids with Crohn's and colitis, it's been incredibly satisfying for me. And it's almost magnifying what I can do. It's great to make one kid well, but when you can mobilize a team and structure a team to efficiently deliver care, to minimize time off from school, minimize pain, maximize fun, and minimize stress for the family, that's been incredibly exciting. And I am so grateful and humbled to be recognized, but I'm so glad I was able to play a role in building a great team.